So polycystic kidney disease is essentially a genetic disease. So in most cases, a patient would have inherited a mutated gene from one of their parents. So it runs in families. And the disease is usually slowly progressing, and patients eventually can progress all the way to kidney failure, oftentimes when they're in their 50s or 60s. The disease is essentially a form of chronic kidney disease, and as you know, chronic kidney disease is very common, affects about 10% of the population, and that's really worldwide. And most forms of chronic kidney disease are really caused by type 2 diabetes, metabolic disease, and so on. But polycystic kidney disease is really the root cause is initially this gene mutation. And one, peculiar thing, if you will, that happens in polycystic kidney disease is, in addition to, deteriorating of kidney function, there are thousands of these cysts that will grow in the kidneys, in both kidneys, and that eventually leads to the damage of the kidney and the destruction of the kidney tissue. And so what we had initially found, and that's probably now pretty much 20 years almost ago, is that this particular signaling pathway called mTOR plays really a driving role in the cyst growth in PKD. And interesting, at that time, there was already a drug available, a drug called rapamycin, that can inhibit mTOR very potently. And we were able to use this drug then in mice with polycystic kidney disease, and it was extremely potent, really stopped the disease progression in those mice. So we published a paper that made a big splash and actually led very quickly also to clinical trials to test this particular drug, rapamycin, in people with polycystic kidney disease. So there was a very fast translation from bench to bedside, if you will. So unfortunately, it turned out once the trials were done, it turned out you can't really